Around 2,000 ambulance personnel, including paramedics, specialist paramedics and EMTs, are set to take strike action next month in a long-running dispute over pay and working conditions. The action, organised by SIPTU, will begin with a 24-hour stoppage on the 12th of May, with further escalations planned later in the month and into June. The union says its members have seen significant changes in their roles and responsibilities over the past 2 decades, without those changes being properly reflected in pay. Joining us now is the SIPTU Health Organiser, John McCamley. John, good morning to you.
Good morning.
This is a long-running dispute. I've just explained from your perspective why this action is happening. How frustrated are members at this stage, given, as I say, their roles, responsibilities have changed over time and isn't reflected in the pay they're getting?
Well, I think the first thing to say is that our members don't want to take industrial action. They'd rather serve the public. They'd rather carry out their normal duties, but they feel like they have no other choice now, because this dispute has now rolled on for 6 years, where an independent report indicated that because of the changing nature of their role and responsibilities, that their pay needed to be adjusted. And we have waited 6 years for the implementation of that report. So we are now at this stage where we feel that we've reached a level where we have to take industrial action, unfortunately. And we have to try to bring this matter to a conclusion.
And in terms of pay scales, what exactly are your members looking for?
Well, I mean, the crux of this is that the independent report recognised that our members have moved from a service which was primarily a patient transport type of service to a pre-hospital care service, meaning that patients were treated either at the scene of an incident or accident or in the back of the ambulance. And this meant that our members went from administrating, 4 medications in 1990 to, for paramedics, 31 medications or 57 medications for advanced paramedics. So this has completely changed their role. It has improved patient outcomes. It's better for the public. And it brings them in line with other health professionals who are paid 10 to 20,000 more for carrying out work of equal responsibility and training. As I said, we're still at the stage where they're still being paid as if they're still providing that patient transport service, and the independent report recognised that that should be altered.
Okay, I know there'll be people listening to the show this morning, John, who'll wonder, well, how would then this potential strike action affect operations at Ennis Hospital here, or indeed patients needing transfer to University Hospital Limerick?
Well, as you know, the National Ambulance Service provides 2 services. One is the emergency ambulance and the other is the patient transport service, usually operated as the intermediate care vehicles and by EMTs. But it is, obviously the industrial action will take place. We have asked to meet with the HSE to put in contingency plans. Our members are absolutely of a view that they don't want to put anyone at risk, anyone at jeopardy, and they want to make sure that any industrial action doesn't have an effect on the outcome of any sort of emergency. So we do have to meet with the HSE. We do have to agree contingency plans to cover emergencies and things like that. So until we have an idea of what those contingency plans are going to be, it's very hard to comment on them. OK, well, perhaps there may not be a need quite yet for contingency plans. The HSE says it does remain committed to dialogue. Do you see there still being a path to avoiding these strikes, John? I think one of the big issues here is that the HSE has time and time again had a precondition on entering into discussions. Our members want as I've mentioned, alluded to, the independent report implemented that recognises the work that's been undertaken for the last 15 years. The HSE wants us to discuss future changes and future modernisation before they even look at pay. So our members believe that, look, they've forgotten about all that work they've done, all the changes that they've made, all is being pushed to one side to concentrate on things in the future. We just wanted to address what has happened heretofore. We're happy to discuss things in the future, but first we need to agree where we were 6 years ago, at least, when the independent report said enhanced pay scales should be brought in.
Okay, well, look, we'll watch this space, and I know many of the listeners will be watching as well, hoping that a strike action can be avoided. John, thanks for joining us. Just before I let you go, we heard in recent weeks, of course, here in this county, we're to receive a significant investment in the National Ambulance Service, 12% expansion of cover, 20 new frontline emergency care staff as well to be appointed in Clare. What's your reaction to that?
Well, obviously we welcome any additional staffing resources, but the National Ambulance Service's own report indicates that the staffing of the National Ambulance Service would need to be doubled, particularly in rural areas. We've pointed to Clare on a number of occasions of not having enough staff within the Midwest region. And while we welcome obviously the additional staff, that is any new staff is there, I think it falls short of what even the National Ambulance Service has put forward in its own plans.
Okay, look, we do have to leave it there. Thank you for joining us. John McCamley, the SIPTU Health Organiser, with us on Wednesday's Morning Focus.